Good evening, everyone. Exploring of pathologic and therapeutic adherence to treatment of type 2 diabetes mellitus in Chepen. 2025, member by person, Rafael Zafra Samuel, Rojas Torres Antonio Michel, Vázquez Chacón Juan Alejandro, Quiroz Mendoza Dina María, teacher, Doctor Billon Prieto Claudia Rosalía. Problematic reality in Japan increase patient weight. General problem was the level of insulin above type 2 diabetes pathology in patients in Japan district. General utility to determine the connection between the level of insulin above the pathologic and therapeutic aims to the treatment of individual diagnosis. Why? Diabetes mellitus tipo 2 in the province of Chepen. General hypothesis, alternative hypothesis. There is a significant relation between the level of nutrition above type 2 diabetes mellitus and therapeutic aims to treatment in patients in the Chepen district. 2025. Null hypothesis. There is no significant relation between the level of knowledge about type 2 diabetes mellitus and therapeutic adherence to treatment in patients in the Chepen district. 2025. Specific problems. What is the level of knowledge that patient with type 2 diabetes is have about the pathology in the province of Chepen? 2. What is the level of therapeutic adherence, pathologic and non-pathological among patients with type 2 diabetes in the province of Chepen? 3. Was thus the level of knowledge about type 2 diabetes mellitus relates to therapeutic aims in the pattern from Chepen? Specific objectivities. 2. Identify the level of knowledge of pattern diagnosis why type 2 diabetes mellitus in the province of Chepen. Examine the drugs of therapeutic areas, pharmacologic and non-pharmacological antibiotic why type 2 diabetes mellitus in the province of Chepen. 3. To determine the relation why between the level of knowledge about the pathologic and therapeutic areas, pattern why diabetes mellitus tipo 2 in the province of Chepen. Author and Doug last name are George Morales Alvarez Martinez Mera, 2024. Richard title and type, knowledge of patient white type to diabetes about this a systematic rally theoretical of contribution. It reaffirms that there is no effective treatment way of education knowledge is predictor of adherence. Where is policy check are parametrica. Aguilar Vázquez et al. A level of knowledge and self-care of the past pattern why diabetes mellitus the two theses. E argues that a quick knowledge improves self-care, Patrick and Arends it type. II Diabetes Repository of the National University of Cajamarca. Review, Revista Médica de Nicaragua. 2024. Factor affecting adherence at type 2 diabetes, a descriptive study. It concludes that lack of knowledge and unhealthy life reduce adherence. Review Medicine Nicaragua. Organización Mundial de la Salud. Diabetes. Fact-check Tianlin report. It provides the exact definition of diabetes mellitus type 2 cause, complication and need of therapeutic areas. World Health Organization work. Die and design of relation approach quantitatively orients toward statistical analysis and generalization. Release type basic design non-experimental link descriptive.
Operations table, variable ones, knowledge about type 2 diabetes mellitus, conceptual definitions. Noise is the information acquired between with T2DM during education expensive or technical understanding necessary to prevent complications. Operation definition. Assessing using and about the KQ24 type question that nurse understand of nursing complications, the treatment and self-care. Dimensions. Basic knowledge of symptoms, knowledge of complications, knowledge of treatment, preventive knowledge, dietary knowledge of physical exercise. Indicators. Definition of T2DM risk factor difference between T1DM, T2DM reckons consequence of T2DM, even micro and macrovascular complications. Recommends medicines and no practical treatment. Claiming control food care. Treatment to parents, what and recent food preparations. Recent to important of exercise. Nursing scale ordinal. Operational table variable to therapeutic adherence. Conceptual definition. Adherence is a pain's beautiful reading medic did physical activity clinical morning endurance aims to control T2DM. Operation definition. Using a scale based in mortality rate and scale car components, medication did exercise, monitoring, and selfie. Dimensions: particular adherence, monitoring, and self-care, appearance and goal of diet and nutrition, physical activity, stars dimensions. In the case stories, correct those taking therapy continue, sell morning of close to cards. Appointment close should be A1 sweet dance. Walking and boarding everything's sugar drinks. Moral points. Activity days per week. Emotional control and coping stories. Machine scars. Ordinal. Categorization table category knowledge about the M2 study clarity and knowledge about to the M conceptual definition informative in the points about the size necessary to prevent complications. Subcategories basic and knowledge, knowledge of assignments, knowledge of complications, knowledge treatments, prevents knowledge, did knowledge, knowledge of exercise. Indicators definitions refactories difference table T1DM, T2DM recommendations of symptoms, identification of complication medical and more preventive management, food care, climate control, stopping for prevention adult for reasons importance of exercise.
Categorization table category therapeutic adherence. Study category therapeutic adherence. Conceptual definitions. Find compliance with medications, diet, monitoring, and physical activity according to recommendations. Subcategories: pharmacological adherence, monitoring and self-care, appointment and follow-up, diet and nutrition, physical activity, stress management, indicators, correct dosage, continuity, self-monitoring of glucose, of care, attendance to appointments, laboratory tests, healthy eating, portion size, avoiding sugar, emotional control. Table 1. Knowledge about diabetes mellitus tipo 2 variable. Knowledge about diabetes mellitus tipo 2 in the study by Nancy I. Marina 2021 within the context of diabetes mellitus tipo 2. Knowledge is understood as the information acquired through human experience, education, theoretical understanding, or practical application of a topic related to reality. It is essential for the patients to possess the information necessary to understand their disease and prevent complications. Dimensions: basic knowledge of diabetes mellitus tipo 2, knowledge of symptoms, knowledge of complications, knowledge of treatment, knowledge of preventions, die- dietary knowledge, knowledge of physical exercise. Indicators: definition of type 2 diabetes mellitus, indications of risk factors, definitions between diabetes mellitus type 1 and diabetes mellitus type 2, recognition of symptoms, identification of macrovascular and microvascular complications, recognition of medication functions, frequency of glycemic control, importance of food card, frequency of medical appointments, identifying foods that should be avoided of or consumed in moderation, re- recognizes that physical activity helps regulate and manage blood glucose levels, scale ordinal. Table 1. Knowledge about diabetes mellitus type 2. Variable therapeutic adherence to diabetes mellitus type 2 treatment. Conceptual definitions. From the nursing perspective, treatment adherence is conceived as dynamic and collaborative process in which the patient with diabetes mellitus type 2 actively integrates therapeutic pillars, pharmacological, dietary, physical, and monitoring in their daily life with that by informed understanding, targeting, and motivation toward metabolic control and prevention of chronic complications. Dimensiones. Pharmacological adherence to morning and complications care, adherence to appointments and laboratory tests, dietary adherence and nutritional control, adherence to lifestyle and physical activity indicators. Frequency with the pain takes the correct medication dose, continuity in medication use over time, frequency of self-monitoring, frequency of food care, frequency of attending appointments, completions of laboratory exams, frequency of consuming recommendation healthy foods, adherence to recommendations, portions, complications with recommended time for moderate physical activity, number of days per week performing aerobic or strength exercise, scale ordinal.
The table presents an assessment of the level of knowledge about type 2 diabetes among 101 patients in the province of Chepen. In general, the results indicate that more than half of the respondents have regular or paper knowledge on the diabetes topic. Dietary knowledge regular. Knowledge was highest for the compassion of the diabetes. Nitrogen present. High knowledge about food preparation in the diabetes was categorized as for which a majority of patients, 58%. They see manages over 64 of diabetes reports regular knowledge receive the pillar of the long terms diabetes control 61 and basic pathophysiology and knowledge of the underlying causing of diabetes 52%. and insulin preparation. 50% was primary regular. Complication and stay car weakened. Teresa knowledge weakens in knowledge consents complete of people. Self-care is virtually areas with a smooth preference of poor of regular. Response including importance of TE glucose control is symptoms of hyperglycemia. Storing area classification of diabetes was the only variables were good. Categories 14%. Was the most frequent suggesting a really bit better understanding of the topic compared to others. Knowledge level. Object 1. Patient in Chepen demonstrated knows the poor knowledge regarding self-care. What many KRS regular or bands. All patients K T diabetes classification. Practice knowledge like diet compassion and food preparation. What critical deficient. The near total log of knowledge about a food care significantly evidence the risk of complication. This general log of robust practical knowledge is a primary factor limiting good therapeutic adherence. The results show irregular therapeutic adherence, and with significant limitation amongst type 2 diabetes patients in Chepen. Response are mostly categorized is sometimes or frequently suggesting inconsistent complaint. K. Findings best adherence, stress and anxiety management 55% frequently. Medication some dose 46% frequently. Weekends adherence self-care guides predominate sometimes. Moderate physical activity 16% only to eat sometimes. Healthy food scale 51 80 help sometimes. Food care 49% practice food care sometimes. Eating during Medicaid use and glucose sheet monitoring also feed minding into to sometimes category. Critical feeding major rates. Avoiding sugar processed drinks. Report doing cheese almost never. Highlighting a critical dietary range. Therapeutic adherence object 2. Adherence was irregular and deficient, mostly characterized by the response sometimes across self-care activities, while medication adherence was partial, essential practice like physical activities, healthy food intake, and food care were preference in country. The most critical finding was that 100% of patients almost never avoiding sugar drinks, despite having modern therapeutic knowledge of diet, demonstrating that knowledge fails to translate into question self-care practice. The result show a weak relationship with knowledge of type 2 diabetes and adherence to care almost patients in Chepen province. Kino assessment. A boring knowledge. The majority of participants show a monitoring and living of knowledge. Best keynote topic. Diabetes classification. Theory 9. Good. A critical knowledge gasped. Shock restoration 19% port indicate almost no specific card knowledge. Diabetes and dietetic compassion 93% very low perfect mesh level. One of the most critical results. Food preparation in diabetes yet 58% for sweet ingredients regarding dietary card table of diabetes 65 regular low performance suggesting prevalent miscomposition that it can be renal function in glucose control 34% port reality port of compassion medic living topic like the underlying cause of the Mellitus 52% regular and insulin production fighting regular general and actual basic but insufficient understanding adherence settings ovary adherence respond promedic I fight into sometimes or frequently suggesting partial and unconscious complaint which medical recommendation area of matter adherence stress and anxiety managed 65.7 correct medication dose 46% moderate completion areas of low adherence avoid sugars procediments drinks one side drink percent almost never representation total DRT no completion and the most alarm findings moderate physical activity 69 sometimes healthy 18 51 food card adherence 49 partial completion interest interrupting are seen in medication use 49 tier and glucose selfing monitor 45% knowledge adherence correlation object 3 this study food a weak association between knowledge and adherence low knowledge which especially in areas like code card and food preparation directly correlated with different practice in shows some areas. This suggesting that the current limits in theoretical knowledge is not sufficient to drive it, sustain practical self-care action, ultimate trading the patient's physical health and overall therapeutic continuum.
A wash climate and rising table to level of man therapeutic adherence inspired with type 2 diabetes meets on the Chepen health facility. It was met a result shows that most participants have only a morning level of knowledge about their diets, especially recommended fundamental space such in the peak diet, self moments and preventing nurse for its wash event. The large province of pines did not consensual are to determine exercise only practical adherence to medicines used as to direct habits, physical arrangements, and self-care to also complement like of noisy about seconds and musical recommendations. should the source recommendation of the importance of diet control. Relax or significant definitions in the healthy educations provided to this population in lack of unique liberty in reducing therapeutic adherence, limiting the bans of the treatment and the IT control of debates the urgent net strain educational strategies prompted or noise giant sense on these interventions attendant to the pain's sociocultural context is a field in this way therapeutic adherence can improve complications prevent and you guilty of live promise of people living which type 2 diabetes mellitus in the province of Chepen.